When I was diagnosed with osteoporosis, it was a real shock, and I found it very hard to take in what my GP was telling me, especially about medication. So this video aims to answer the questions that you've got about the medication you may have been prescribed.
What do the drugs for osteoporosis actually do, and how do they work?
So the drug treatments for osteoporosis have been developed after decades of research, and their primary aim is to reduce fractures, and they do this by making bones stronger. There are a wide range of available treatments. Some are tablets, some are solutions, some are injections, and some are infusions. And you can take these daily, weekly, monthly, 6-monthly, or annually. So we really do have a drug treatment for nearly every type of person. Usually we will start with a drug that you take orally once a week. It's called alendronic acid, which sounds very scary, but it's not an acid at all. It's actually a salt. And alendronate works in a very simple way. It sticks to calcium. And when it sticks to calcium in your bone, it stops the bone being broken down and can actually make the bone stronger.
So when I've actually started my treatment, how long can I expect to be on it for?
Any type of treatment you have will eventually wear off. Different treatments have different levels of stickiness to bone. Some wear off very quickly and some wear off after some years. We currently recommend that people taking the injectable treatment denosumab do not stop treatment unless under the care of a bone specialist. For the weekly tablets, after you've been on for 5 or 10 years, depending on your risk factors for another fracture, you can maybe have a pause in therapy for 1 or 2 years, but then you should be thinking of restarting. The daily injectable treatment, teriparatide, is part of a sequence of treatment. So once you finish your daily injections, you should be put onto another treatment within months. The intravenous form of the oral bisphosphonates, called zoledronate, that is very sticky to bone. And usually we give the injections every year for 3 years and then may give up to a 3-year pause before reassessing. Each of these drugs have different side effect profiles and are only applicable to certain groups of people. And there are people with some other conditions such as heart attacks or strokes or kidney disease who won't be able to get some of these treatments. So when your doctor is deciding which treatment is good for you, they're looking at your chances of having another fracture, but also looking at your other medical history and also your blood results. And by combining this, they can give you a really personalized approach to reducing the fracture risk with a treatment that works for you. And there will be people who will break a bone while they're taking anti-osteoporosis treatment. This does not mean the treatment isn't working, but it does mean that you should discuss your bone treatment with the person who gave it to you, either in the hospital or your GP setting, to see if the treatment that you're on now is still the best one for you, given your risk of another broken bone. One of the biggest problems we have in the NHS is that we identify people who should be on treatment, and then for a number of reasons, they don't finish the course of treatment.
I know some people who've got osteoporosis also have pain. Will the drugs help with that?
No, unfortunately, the drugs for osteoporosis will not have any impact on your pain. However, the drugs for osteoporosis will be working within your body to strengthen your bones and reduce your risk of having a further fracture in the future. If you are experiencing pain after a fracture, then it's really important that you speak to your GP or healthcare professional so you can get some advice and help with pain management.
And once you're sure it's working for you, the best advice is to stay on treatment, maybe for as long as 10 years, if not for life. This treatment is so good at preventing fractures, long-term therapy is likely.
My name is Julia, and I'm one of the specialist nurses on the Royal Osteoporosis Society helpline. Please remember that we're here from Mondays through to Fridays if you have any questions or issues that you'd like to discuss with us as a result of watching this video. Calls to our helpline are free and are confidential, and no question is too small. You can also visit our website to find out more about the subjects we've covered, plus a lot more besides. We have a network of support groups across the UK, led by volunteers for the benefit of people living with osteoporosis and broken bones. To find out more, please visit the support group pages of our website. Please do get in touch. We'd love to hear from you.